Psoriasis is a type of inflammation that happens in the skin, where the immune system goes from doing what it's supposed to do, which is fight off infection, and instead turns against the skin cells themselves. What this results in are spots that are red and scaly on different parts of the body. Sometimes patients come and they've been diagnosed with eczema or fungal infections, but in fact, when they see a physician who's skilled in understanding the cutaneous signs of psoriasis, we can actually quite rapidly make the diagnosis. For example, we know that psoriasis will frequently appear symmetrically on both elbows or both knees, and that it also has a predilection for the buttocks, although it can also affect the scalp and even the entire body in people who are severely affected. When it comes to causes of psoriasis, everyone wants to know whether it's something they did, and our answer is consistently no. In fact, our understanding of psoriasis is really evolving. We now know that there are some people who have genetic factors that run in their families, but that there is also likely an environmental influence. When it comes to thinking about treatments for psoriasis, it's really individualized on a patient-by-patient basis. So if someone has just a little bit of psoriasis, we can frequently treat it with simple creams that people put on at bedtime. But as the amount of psoriasis increases, or if it's in special locations like on the scalp or in the genital area, we can move from creams to something called phototherapy, which is medical sunlight. And then for cases that are more severe, we consider things that you take by mouth and newer, very targeted therapies, frequently called biologic therapies. These are specifically targeting molecules that are involved in the psoriasis inflammation. It can go in and essentially suck up these extra inflammatory molecules, and we can completely eradicate skin psoriasis and also improve the joints and potentially reduce the risk of cardiovascular disease in patients with psoriasis as well. At Yale Medicine, we try to come up with an individualized treatment plan for every patient. And I think about one person in particular who came to me, and there wasn't a single square inch on this individual's body that wasn't affected. He was itchy, he was red, he was scaly. He told me that he had to carry a vacuum with him so that he could vacuum up the scale everywhere that he went. We decided upon a combination of two things, an oral agent and one of these newer biologic therapies. And it was really wonderful to see him come back a few weeks later, seeing a break in his psoriasis, and then a month later, coming in and being entirely clear. I am Dr. Keith Choate from the Department of Dermatology at Yale Medicine.